Welcome to Power Hour. The Pediatric Epilepsy Surgery Alliance is the only nonprofit organization whose sole focus is serving the community of children anywhere on the epilepsy surgery journey, from the point of drug resistance through surgery, including the transition to adulthood and beyond. We empower families with research, support services, and impactful programs before, during, and after surgery. Formerly known as the Brain Recovery Project, we are in our 12th year of serving this community. Our Power Hour sessions are brought to you by our corporate sponsor, UCB. And today we're going to discuss future planning. What future planning is thinking about what are you going to do for your young adults so that when you are no longer here to care for them, they still have the support services, living arrangements, finances, whatever they need to continue living the best life that is available to them. So future planning involves creating a plan for your child's life to help them prepare for adulthood and also for when you are no longer here to care for them. You've heard me say before, if you've heard me speak before, that children with disabilities are often described as falling off a cliff once they leave high school due to the failure of planning and implementing effective transition plans, which should be taking place during the high school and transition program years. Once they reach adulthood and age out of their program, many things change. So at 18, they become a legal adult, regardless of their abilities. So it's important as parents that we determine what decision-making supports we want to utilize. I'll talk about that today. You may need to apply or go through redetermination for services such as SSI, Medicaid, et cetera. You want to think about protecting your child financially with a special needs trust or ABLE account in order to keep their state and federal benefits. And if there's a lot of concerns around housing, employment, and just the quality of life our young adults will have. Those with higher support needs due to an intellectual, developmental, physical disability, medical complexity, or behavioral challenges may have nowhere to go, nowhere to learn, or nowhere to work in the community. And this situation for many young adults with high support needs and their families has not improved much over the years, unfortunately. So at this point, you want to just stop and take a deep breath and think about some things. Just ask yourself some questions. And I don't know how you work with challenging topics. I think future planning is a challenging topic. It feels like an elephant, and the saying is you can't eat an elephant all at once. You have to do one bite at a time. I'm not sure if that's the exact saying, but that's how I remember it. And so if you look at future planning as an elephant and you just always go, yeah, I'm not dealing with that elephant, you won't ever make any progress on it. So think about where you can start. And maybe you're going to start by writing down a list of questions and then starting to ask them with your family, with other people that might be on your child's care team as adults, even with your young adult or your teen or whatever age your child is in. So here's some questions to think about. Think about what stage of life you are in. So I'm 55. My son who had a hemispherectomy is 19. And we also have a 17-year-old. So we have two kids in college, and at some point we want to retire. So when I think about stage of life, that's what I'm talking about. Like, where are you in your own financial trajectory, career trajectory, and like the financial responsibilities you have? Think about what type of disability your child has. So there's cognitive, developmental, visually impaired, physical, mental behavior is a big issue in adulthood. Often that's not addressed fully, and then they reach adulthood and sometimes they can't access services. What are your realistic goals for your child? So I think what we all want at the end of the day is for our kids to be healthy, to be happy, and to have something in their lives that gives them meaning. I think those are, and have relationships and friendships. So I think those are kind of key foundational things. Some of the bigger societal expectations for young adults are things like go to college, have a job, have a family. Those things might not be available to all of our kids, but the first set, healthy, happy, in a safe environment, having meaningful relationships, having day-to-day meaningful experiences. I think we can ask for that for all of our kids. What's your biggest fear for your child, right? That's the other thing to think about. Like, what are your biggest worries? Because that might be a good place to start and make sure you get whatever that worry is in place. Like maybe it's housing, maybe it's transition to adult medical care, maybe it's finances, right? So maybe that's where you start. Start thinking about what will happen to your child once you're gone. So I call it the Hawaii the Hawaii plane crash kind of thing. Russ and I, my husband and I, decide to go to Hawaii. We both crash on the plane and we're dead. What happens, right? So that's where the letter of intent, which I'm going to talk about at the very end today, but that's where that comes in. And I'm bringing it up now so you can start to think about it throughout this presentation, because everything we're talking about should go in the letter of intent. So you're basically starting to write out a blueprint for your child's life. My child is quote unquote high functioning and he's in college, but I still have this. I still have all of the supports I'm going to discuss today are all in place. If your child needs 24/7 care, you can't wait until they age out of their transition program to set that up. You really need to start now, as early as possible, whatever age your child is. Maybe not 5, but certainly by 12 to 15 years old, you're starting to think about that and having those conversations. You want to think about government benefits, what type of job or volunteer position you might see your child have. What are your hopes for your child's future? What do you hope they will do? Do you think they'll live with you, live on their own, live in community? And really important, have you communicated all of these dreams and ideas and hopes and thoughts and expectations with your family members, with other people that you think might be taking on caregiving responsibilities for your child when they are adults and when you're gone? And also thinking about, what does your child do for fun, and do they have friends? And then think about all of this, your plans for your family, your hopes for your child, and how does it tie together with the whole family's needs, because none of this ever happens in isolation. Okay. So when we think about what we want to focus on as our young adult is entering kind of adulthood, and I think of that transition to adulthood could take 10 or 20 years, right? Like leaving high school or your transition program, you're entering adulthood, but it could take a very long time to put all the supports in place and really train them in being adults, right? So I think that regardless of their level of their disability, the focus should always be helping develop a vision for a good life. So you're thinking about it, you're talking about it, you're imagining, you're deciding what does a good life look for your child? And you want to use tools like person-centered or family-centered planning so that the person with a disability is at the center of all decisions made about them. And that's where that self-determination comes in, where they're really feeling like, I am determined to make my own decisions in my own life. We need to think about what they need to know and do. So can they communicate their wants and needs? How do you maximize their independence and skills? This is going to lead to employability, right? And that level of employability might vary, but having some level of employment, even if it's part-time or volunteer, can again give them that day-to-day meaning. We want to think about things like supported adulthood, which means we're not expecting them to do everything, but we're really starting to recognize, where does my young person need supports and where are they fully independent? And then just making sure you have those supports in place. The independent living skills are key, and we'll talk about that as well. So these are some of the key considerations to think about as we enter this process. The reality is that parents really take on the role of case manager in adulthood. So there is no coordinated case manager in general. There are some exceptions, but in general, the parent becomes the case manager in adulthood. And also there's no curriculum to educate parents on their role beyond the school years. But learning about transition really should begin early, at least by age 14, I think. You should need to start thinking about this, or even earlier if possible. What are the issues that your young adult will face when they leave the school system? And not only leaving the school system, but leaving pediatric medical care, because those are two systems that are very coordinated with one another. There's actually a lot of communication. I know it seems like maybe that's not always the case and it can be frustrating, but once you enter the adult world, everything is very siloed and all of the connections are made by the parent in general. So you really want to think about and learn about options for your adult child as soon as possible. What are the options for your child's life after high school? And you need to advocate for individual services if no services exist for the youth's needs. And you also have to think about, where is the funding going to come from for all of these needed supports? So all of these pieces need to come together. They need to magically be in place by the age of 22, or whatever age it is that your child leaves the school system, 18, maybe if they have a diploma, up to age, I think 24 or 25 in some states through their transition programs. So you want to learn as much as you can about the adult resources agencies, eligibility requirements, the process for applying, et cetera. And then lastly, I want to make sure that families ensure that respite for the caregiver is part of the individual's care plan. No one can go on indefinitely caregiving for an individual with significant needs without a break. So when you're making these care plans or these future plans, really thinking about where does that caregiver respite come in? When does the caregiver get a break? So there was a survey, this was in, I think it was in Disability Scoop, 400 parents of children ages 3 to 68. So a wide range of ages of children. So when I say child, I always mean the child of any age. It could be an adult child. Responded to a national survey on what they had done to ensure the future care for them. And only 3.6% of parents had completed the full list of all 11 tasks that researchers had asked about, including establishing legal guardianship, power of attorney, securing a residential placement, etc. 32% had done a moderate amount, but 12% had done nothing. So that's why we're here today, is to hopefully get you to start thinking about some of the things you can do and put in place. So some things to think about for future planning. You can meet with an attorney who's knowledgeable about disability issues. They can help you with a lot of this framework. You want to discuss your future plans with the entire family. You want to discuss the future plans with your child with a disability, right? As much as possible, as much as they are able to be part of that conversation, so that they're self-determined. You want to make sure there's a successor to follow the family caregiver. So we have our plan, which includes a special needs trust and a letter of intent and all of that. We have kind of a succession plan from me, my husband, and then who's next and who's next and who's next. So that if we all die before my son does, that there are people in place that know him well and that will be able to support his needs throughout his adulthood. Creating a letter of intent, we'll talk a little bit about that. You want to establish the powers of attorney, legal guardianship, do the financial supports, residential programs, and make plans, residential plans, or take proactive steps towards securing a residential placement. Sorry, there's something in the chat here. I'm not able to read it for some reason. Okay. So here are the core areas in a future plan. This is from the ARC's Center for Future Planning. I thought for a while the ARC was not an organization that applied to me and my son, because my son does not have Down syndrome or a major intellectual disability, but he does have a developmental disability, as a neurodevelopmental disability as a result of his epilepsy and epilepsy surgery. So I did a training through the ARC. I became a certified future planner, and I really like this framework. And I recommend, I have some resources I'll share at the end as well, because it's a really nice, simple way of viewing what is a future plan going to consist of. So we're going to go through each of these. So expressing wishes for the future. So you want to make sure that you're always using self-determination, self-advocacy, self-awareness, person-centered planning, supported decision-making. So self-determination skills include goal setting, decision-making, problem-solving, includes that self-advocacy and self-awareness. And then person-centered planning is putting the person with the disability at the center of all the decisions that are made about their life. The person with a disability, no matter what or how significant their disability is the most important person involved in making decisions about their lives. And it's really important that we always remember that. Supported self-determination assists students with severe and multiple disabilities to experience a quality of life consistent with their values, preferences, strengths, and needs. Helping students with significant needs to be self-determined does require thinking outside the box, though. So this is where maybe they can't communicate their wants and needs, but there are caregivers or family members that know their wants and needs and can state them for them. Like the parent always knows what their child of any age is most interested in, right? What going to the zoo, or a certain video that they like, or a certain food that they like, etc. So that's where there can be supported self-determination as well. Deciding where to live. So we want to think about the long-term living arrangements for our young adult. For some, they may change. A typical young adult will change living situations. I think it's like 10 times from 20 to 30 on the national average. But for our kids, we really want to be thoughtful and plan what is their living situation going to look like. So we want to apply for local and regional housing lists. That could be Section 8 housing. And we can also ask if there are portable vouchers. So I'm in California, and in California, there are some agencies that will help me get a Section 8 voucher from another county and port it into my county. And I haven't actually done this yet myself, but I've been told that I can take that voucher and apply it to we have a rental apartment on our property, and we can use that voucher to rent our son our own apartment, basically. A parent asked recently about, earlier on this call, about setting up a group home situation in their own home. So that might be possible as well. You want to get on these waiting lists for the Section 8 housing and the vouchers as early as possible, because sometimes the waiting lists are very long. And we really want to take those proactive steps. What living situations will be available for your young adult will vary a lot depending on your state. So wherever they live, they should be assured that they're safe, that they have well-being in their home, and that they have safe and happy community and relationships. So that's just a priority always. So shared living can be where the person with a disability lives with a family who supports them in their daily activities and includes them as part of their family. And it could also include a roommate or roommates who serve as caregivers or attendants. And I will send some resources out today after this, which describe these different descriptions that I'm sharing with you. Supported living means that the individual or family chooses the home and roommates, and it's not owned by or funded by an agency, and supports are provided by the individual based on his or her preferences and needs. So the difference there is that a home of their own choosing, and it's funded, it's not a group home, basically. There are still group homes. There is state and federal funding, such as Medicaid waivers, which support the majority of group homes. But again, sometimes those waivers, that money, can be ported or moved into a different living situation. About 75% of adults with intellectual and developmental disabilities live at home with family, according to the ARC's National Survey on Housing. They choose this option, which I find kind of funny. I sort of think it's that we don't have a lot of other options for our young adults with intellectual and developmental disabilities and other disabilities. There are organizations that have inclusive living opportunities. So Best Buddies, which is a national friendship organization for adults with disabilities, they have recently opened inclusive living housing in Florida and Washington, D.C. And then there are some organizations that provide information and resources and help you figure this out. So there's the Coalition for Community Choice and Together for Choice. So that is, those are some resources you can look into. I'll be sharing some additional resources. If there is not an option available for your individual with disabilities, your young adult, you need to ask your state to help you create an appropriate group home, or to hire another vendor to provide services, etc. Sometimes at the level, like the Developmental Disability Services Office, your DDS office or whatnot, or even the housing office, there'd just be a lot of I don't know. I've heard of families going to their state legislators to advocate for support with getting them appropriate housing. And there's some shared information there in the chat, which I'll make sure to include in the resources I send out. So when we think about supported living, there's a way to have supported living, which is not the same as a group home. That's where you have a home of your own, you have choice and self-direction, relationships are prioritized, and being a member of a community. And then you want to have that flexible, tailored services and supports as part of that. So again, that person-centered and family-centered or supported planning is essential for this to be successful. Sometimes case managers get involved. It depends on your state and the level of support. Self-directed services means that this person with a disability chooses how to use any money available to them from their state service agencies. So if your young adult is able to do this, they can be their own self-advocate. I'm in a Facebook group for California, and there's an adult self-advocate who's frequently posting in this group of adults in this self-determination group. And she's a powerful, powerful advocate. Yes, she has a disability, but she's very much driving and directing her own services, which is really important if possible. And then when we think about living independently, it's not just housing, it's what are the skills that they're going to need to learn and what supports are there. So there are services that support independent living, that allow individuals to live in their homes and their community instead of institutions and group homes. Each state provides these supports in different ways. Some use their own state organizations, others use managed care organizations who may not understand how to appropriately support your child. And there can also be waiting lists in some states, and the process of applying can be lengthy. But you want to look into what is available in your state. Organizations like the ARC, like Best Buddies, trying to think of what else. There are organizations that their mission is to help individuals with disabilities live fully included in society. So they might be resources. Your state chapters of those organizations might be resources for you. For some, even because of their individual needs, a group home will not be a good fit. So supported living services allow people with disabilities to have a home with specific services for them, either in their own home or in the family home. A person with a disability can get assistance in a group home. It's different than having a home of your own choosing. So there are services called independent living services, which can be accessed before or after they leave the family home. So my son started receiving these services in high school and continues to receive them now in college. This is about teaching them to learn skills to be independent, like cooking, house cleaning, grooming, money management, etc., and are tailored to their ability level. Usually this is one-to-one instruction, and it can be, it's usually given until the individual has mastered the skill, or if they don't master, or it seems they will never master certain skills, then they would move to supported living services where they're getting support to do tasks that they can't do independently. So the other acronyms on this page, supported living services, SLS, long-term supports and services, LTSS, and home and community-based services, HCBS, are terms you're going to start to hear as your young person transitions into adulthood, and it's really important to know what they mean. I'm just going to use the term SLS right now for the rest of this slide to cover any of those, because it's going to vary state by state. Some states will not allow you to receive SLS if you're living at home with a family, but you might be able to receive other services like attendant services, independent living services. The SLS, the supported living services, usually include help for household chores, personal care, developing a circle of support, financial management, even job skills training. There can be lots of supports. SLS is available in all states, but there can be a long waiting list depending on what state you're in. So you want to check with your state to find out the availability of supported living service waivers in your state for people with developmental and intellectual disabilities. And remember, if your child had epilepsy surgery or even epilepsy, they most likely would qualify with having a neurodevelopmental disability, which does fall under these waivers in general. These services are generally funded with HCBS, Home and Community-Based Service Waiver, which is a Medicaid waiver, and it falls under the long-term home and community-based services options in your state. And these waivers can be used to pay for everything on this slide that we just discussed, plus personal care assistance, respite, transportation, supporting community activities, adult day programs, etc. So to start right now, get your child assessed. Some states require assessment, and some allow them to be assessed before they turn 18 or move out of the family home. You want to make sure you have these services in place when the child's ready to move out. And when we think about the independent living skills or tasks that contribute to the independent functioning of individual, we want to make sure that we address their leisure and recreation skills, home maintenance, personal care, and community participation. I'm not going to read this slide in the interest of time, but we want to make sure that some of these things are addressed. I will just touch on communication. So if your child cannot communicate their basic wants and needs, what tools do they need to communicate successfully? What tools or training will their caregivers need to understand them? I think that is such a key piece for any youth with a disability, but especially for an individual with a more significant disability. If they don't have sufficient self-care skills, for example, do they have the ability to direct their own care, or what support do they need? So in any of these areas, if you're like, oh, my kid's never going to do that, that's fine. So now you just say, okay, this is a support need. And now what support will he need, and how are we going to get that support? How are we going to piece this together? This is a great idea. I love this life skills lady. It's a friend of ours out of Connecticut. And she is a parent advocate and the parent of a young adult with multiple significant disabilities. And she has this great resource. You can just look her up online, but she just gives a list of examples of different life skills that you can practice and work on really throughout childhood and even throughout adulthood. So if you're watching this presentation and your child is 5 or 6 years old, you know now what things you're going to need to start working on. So there are skills that children can learn that are going to help them with eventual adulthood. The next is financing the future. I'm not going to spend a ton of time on this because we did have a webinar recently with a financial planner, which is on our YouTube channel, so you can check that out. We had one on financing the future and one on ABLE accounts. but I'm just going to do a brief overview for you here. So a special needs trust ensures that your child will continue to get the services they need when you're no longer around. So one purpose of a special needs trust is to preserve the ability of an adult child to continue to receive public funded supports when when the parents have died. Basically, it's a way to put money somewhere so that they don't have assets in their name, so they continue to receive public benefits. Another important thing to think about is whether the individual will be able to manage an estate, basically like a special needs trust. And in our case, for my son, we set up a trust advisory committee. So when we pass, the trust will spring. It's called a springing special needs trust. So it doesn't exist until we die. And then whatever, 401k, our home, insurance policies, everything are named. The trust is named, not our child. So he doesn't get excluded from benefits. Then we have a trust advisory committee that will manage that money for him. So the money belongs to the trust, not the individual. And we want that team of supporters managing the money. There are also public trusts, and there are also fiduciaries that you can hire to help you with the money management if that's something that feels really overwhelming. The ABLE account, the ABLE Act allows people with disabilities to create a tax advantage saving account. It's called an ABLE account. This can be used for any qualified disability related expense, which is really almost any expense. And that includes education, housing, transportation. It allows people with disabilities to save money without losing their eligibility for their federally funded benefits. And you can put away up to $100,000 before it impacts any federal benefits you might receive. There's some information on our previous Power Hour about ABLE accounts that can go into more detail here. For your personal income, you want to do things like create a will and talk to somebody about estate planning, and how to also, there are special financial advisors that help you coordinate government benefits, insurance, investments, and your own money that you might want to have for your child as an adult. And then Social Security. So benefits.gov is an official government benefits website. It's free, it's confidential, it's a tool that helps individuals find government benefits that they may be eligible to receive. So it's benefits.gov, very straightforward. I've had some parents say, I don't want to apply for public benefits because I can't navigate the system, it's too hard. Or they say my child doesn't really need those benefits. But what I see is that families don't really understand the long-term benefit of having services available to them. They haven't addressed the question of what happens to my child after we're gone. And even if the parental income and support is sufficient right now, your child will hopefully outlive you. And then these public services can serve as additional support when parents are gone. There was a presentation I watched once by a financial advisor, and he discussed a parent who just refused to apply for any public benefits for their child. But then there was a program, and usually we see that there are very few programs in our community that are appropriate for our adults. There was a program they really wanted their daughter in, and they said, no, you can't, because this is only for people who are receiving SSI or Medicaid. And you don't have that. And they were like, we'll pay anything to be in this program, because there was no other option and they were not able to access that. So that's another thing to remember, is it can be a protection that comes from being identified as an individual with a disability on that federal level. Social Security offers two programs to help pay for living expenses, primarily housing and food. The first is SSI, or Supplemental Security Income. This is considered an entitlement program, which is for people who have never worked, who are believed to have a limited ability to work or sustain employment. So some families receive Medicaid when their child is younger. When they turn 18, you need to reapply at 18 in most cases, or maybe you're applying for the first time at 18. For example, my son, before 18, we didn't have the income qualification for Medicaid, but once he turned 18, he had no income and he had no assets, because all of his assets were in his ABLE account. And so we were able to apply for SSI for him. One of the benefits of SSI is that they receive Medicaid health insurance for life, whether or not they're drawing on those SSI benefits. So what that means is they might get, it's not a lot of money, it's around $1,000 a month, depending on your state, from SSI. And let's say he gets a job and he makes $1,000 a month, he's not going to get that SSI, but he'll always have access to the Medicaid. So if he can't be on my husband's work and health insurance, or once we pass away, we'll know that regardless of his employment status, he'll always have that benefit. And they can also benefit from other work incentive programs through SSI. Social Security Disability Insurance, SSDI, people often get confused with SSI. That is for people who with disabilities who have worked enough in the past to qualify, but who are now not able to work. So it's more of an insurance policy. Basically, you work and you earn credit to receive SSDI. But the important thing to note with SSDI is disabled people who have retired parents can receive SSDI. So when my husband retires, for example, he can apply for SSDI for our disabled adult child, and he will be able to receive a more significant benefit than SSI. And the benefits are based on how much you've paid into Social Security. So for my husband, it will be based on his, and I think the benefit is close to double what he would get just on straight SSI. So that's really important. SSDI also has a work incentive program. Supporting major and daily life decisions. So at the age of majority, this is the legal age established by the state law when a person's no longer a minor. In most states, this is age 18. Whether or not they are ready for the responsibility, your child will have control over and responsibility for their educational, medical, financial, and other legal decisions and actions. So depending on your state's regulations, many rights as a legal guardian automatically transfer over to your young adult. You might have concerns that your child can't make competent and informed decisions independently or might need more time to develop those skills. So there are both informal and formal decision-making support options to help your child make decisions for healthcare, education, financial, legal, et cetera, from the least restrictive, which might be a signed consent form at a doctor's office, to the most restrictive, which is legal guardianship. So you want to meet with an attorney to discuss these options at least a year before your child turns 18. It can take time to set up legal agreements and plan for the student's financial protection as adults. When it comes to determining what's the best option, advocates often state that the least restrictive ones may best support and promote the young adult's decision-making skills and rights. And I do agree with that on a theoretical level. But I'll just tell you my personal story on a practical level. I have a son who had 3 brain surgeries and has a shunt, and he does not really fully understand his own disability or his own medical history. I don't know that he would be able to articulate his medical history or his even symptoms of a shunt failure or other medical concerns appropriately to ER staff, for example. And during the pandemic, my mother, who's elderly and has dementia, had to go to the emergency room. And I went with her and I tried to go in and they said, you can't go in. And I said, well, what do I need to go in? She said, you need to be her guardian. And I said, what about a power of attorney? And they're like, no, that doesn't count. So if I want to go into the hospital with my son when he's incapacitated from an injury, I need to be his guardian. I need to be his legal guardian. So that for me was that tipped me in that direction. So in California, we have conservatorship, which is where you get up to 7 powers determined by the court, which does allow the individual to keep some of their rights, as many of their rights as possible. But for my son, I really felt for the medical decision-making I needed to be his conservator. Other states, it's just straight guardianship, and it's a little bit different. Supported decision-making is basically a group of supporters selected by the adult with a disability, helps them make decisions about their life choices. There are some states that recognize supported decision-making as a decision-making entity, but most of the medical providers I've talked to about this have said they don't recognize it in an emergent situation or for making those decisions in a medical setting. And then power of attorney is another option you can make. If you suspect your child might not be an informed decision maker by 18, and you want to just extend the runway a little bit, power of attorney is very easy to get. You just fill out a form and have it notarized. You can do it at like a UPS store or postal store, and then it's very easy to remove. Again, you have to go in front of a notary with a form to remove the power of attorney, but there's no attorney involved. It doesn't really cost anything except for the nominal notary fee, which I think is $20 or $30. So it's a simpler and less costly than a conservatorship or guardianship. You also want to think about the healthcare decision-making, because your now adult child is in charge of making their own healthcare decisions, right? Once they turn 18, only they can access their medical information unless they give permission to the healthcare providers or a decision-making authority. So you might consider getting permission to make medical decisions on their behalf. You could get a medical power of attorney or a durable power of attorney, which enables an individual to appoint a trusted relative or friend to handle specific healthcare decisions on their behalf. In some states, this only allows decision-making when the individual is incapacitated, more like a healthcare proxy. So you need to be aware of that. Again, if you want to have total access to their medical records, medical decision-making, et cetera, that might not be appropriate. And a healthcare proxy, again, it's just something to give medical authority, decision-making authority to a caregiver if they're incapable of making an executing healthcare decisions. So my younger son, for example, who's going off to college, he'll turn 18, he'll be a legal adult. We're not his guardian, we're not going to get guardianship. So he can sign a healthcare proxy so that if something happens to him, we can still go in and advocate on his behalf. And then really thinking about end of life decisions. By the age of majority, you want to be having again, it's part of that whole letter of intent and thinking this all through in your future plan. What do you envision for your child, and what does your child envision if they were to pass away, or if they were to need hospice care, or some care like that? So you want to be starting to think about these decisions. And some families want to donate their child's brain for research, and so that would need to be part of that end of life decision that's written out, if that's something that you're interested in doing. So we also need to think about the shift from pediatric health systems and supportive school systems to the adult health systems and community-based service systems, which again, we go from a more coordinated set of services in school and pediatric care into a very siloed system. I'm going to do a power hour later this year just on healthcare transition, so I'm going to just very briefly talk about this today. But basically, you want to make sure that you're aware of the legal changes that happen, the age of majority, what are the legal decision-making supports you're going to put in place? Are you using self-advocacy and supported decision-making? What about HIPAA? You want to make sure that once your child turns 18, you can still speak to and make decisions on your child's behalf. You might be able to just sign a HIPAA waiver depending on your state and your medical practice. And then if limited conservatorship or guardianship isn't appropriate, consider that advanced healthcare directive. So for providers, you need to, you and your teen, the family and the young adult or teen need to learn about the difference between pediatric and adult doctors and how they work. Recently, I heard someone speak about how, I know for my child, his neurologist basically was his default primary care provider. Like she was the one we went to for pretty much everything, filling out forms, just really knew my child best. She was a very holistic provider. In adulthood, no neurologist is going to be your adult child's primary provider. That's not going to happen. It's a very different system where you have a primary care provider and then each individual specialist, and there's not a lot of communication. If your child has complex medical issues, you really want to start researching adult medical providers and finalizing transition from a pediatrician to adult primary care. We do have a guide to healthcare transition after pediatric epilepsy surgery that I'll share with our resources after today's presentation. The other concern is that finding doctors willing to take patients with multiple and significant disabilities can be challenging. We have to think about financing. How are we going to fund medical care? Are you going to be accessing state or federal programs? What health insurance are you going to have for your young adult? Is it going to be through private insurance through your work or through Medicare or Medicaid, dental insurance, all of that? Management, you need to make sure your teen understands his or her healthcare needs and how to manage them, how to keep medical records, how to manage medications and appointments, how to promote their health and quality of life and well-being. And again, if they're not going to be able to do these things independently, then that's where you're like, okay, my young adult is going to need support in these areas of healthcare management. Do they know what an emergency is? Do they know the difference between calling 911 and going to urgent care? All of those kinds of things. Mental health also needs to be supported. A high percentage of adults who have a history of epilepsy, much less epilepsy surgery, they have much higher incidence of anxiety and depression in adulthood. So we really want to make sure that there are mental health supports, but the mental health is even a more separate system, and it can be challenging to coordinate care between the physical and psychological health worlds. So it's just something else to be aware of. And then again, emergencies, you want to have those plans for what to do in emergency. What is a medical emergency? And maybe practice those things with your teen or young adult, or even if they're already adults, continue to work on those things. We want to start thinking about employment and daily activities. So we're going to look into maybe vocational or job or recreational opportunities for your child. We want to focus on social skills and community participation. They might need to be taught those skills. We need to ensure transportation. What about their daily living skills like cooking and financial literacy, decision making, self-advocacy, self-determination? Again, what will your child's everyday life look like when they are an adult? After their last day of school, when that bus pulls away, or their last day of their transition program, what will they be doing? What will help them find meaning in their day-to-day life? Not everyone is going to work, but they may work, they may volunteer, they may attend a day program. You want to make sure they're in a setting, doing something with their time every day that gives them meaning, and where they're in a setting that they actually want to be a part of. More than half of parents identify significant concerns regarding their child's future employment in 5 areas: their social and communication skills, their ability to be hired, their ability to apply for and find a job, opportunities for on-the-job support, and limited familiarity with vocational supports and options. So hopefully today you've learned about some of these things and can start to be proactively asking for some support in these areas. So when you think about employment goals for students with disabilities from mild to significant disabilities, that might include, it should include participating in productive work activities at the highest level of their independence and ability. So students should qualify for services through their state's vocational rehabilitation department. They can provide vocational skills or other job training and accommodations. They can provide devices like assistive technology devices, a laptop, etc. They can pay for college or other training programs. You want to consider pushing for a vocational assessment for your young adult if they haven't had them. The state's VR agency will develop an individualized plan for employment. Your student can access student voc rehab services and adult voc rehab services at the same time, even though they might be told that they can't. When we think about employment options, supported employment is for those who really need intensive support to find and maintain work because of their disability. There's a movement against sheltered workshop work. So you want to really make sure that you're clear about what is that supported employment. And then customized employment refers to competitive integrated employment, which is for an individual with a significant disability. But the idea is that they are matched, their specific individual abilities are matched with the business needs of an employer, and then they're provided with extensive support. Again, you want to look into what your state offers. And then you want to make sure that job accommodations are provided based on the individual's disability. The Job Accommodation Network, or JAN, I believe it's askjan.net. They have a great list of different accommodations for different disabilities. And you can take a look at that and ensure that those accommodations are in place. When we think about what are the indicators for successful outcomes, what things needed to happen to make sure that your young adult is successful in employment, the number one thing was high expectations by parents that their child can get a job and or that they can become self-supporting. So I have high expectations that my son can work. I'm not sure he can be self-supporting, but I do think that he could have at least a part-time job to find daily meaning in his life. Another indicator for success is that they had a paid work experience during high school. That's the number one across disability and non-disability. Actually, having a job in high school is the number one indicator of post-school success for any individual. There are school-sponsored career development activities that are associated with improved post-work status. Oftentimes, they're not available for individuals with more significant disabilities. So again, you might need to ask for that intervention to be targeted or for additional supports to be in place. And again, any actual hands-on work experience rather than preparatory experiences or indirect experience, again, the most critical predictor. So it doesn't necessarily need to be paid, but at least if they have that actual work experience, it's going to be better. And then some adults with disabilities will attend structured day programs to work on their various functional vocational skills and enjoy recreation and social activities. They can be called a day program, a day hab, or a day habilitation program. They often occur at a nonprofit community agency like the ARC, with employed staff, and they're often funded by Medicaid or your state Department of Developmental Services, or in California, they might be funded by Regional Center. And they're supposed to provide individualized support for adults of all ages, including those with complex medical needs. I will say that in San Francisco, for example, if the individual's not toileting independently, they cannot get into a day program in San Francisco. So again, you need to be really aware of what are the day programs and what are the limitations and what do I need to be working on to make sure that when that bus comes on the last day and drops my son off at home, I know that the next day he's going to have the supports that he needs. There are also day programs for individuals with significant mental health needs. It really depends on the individual. Access to transportation, I wish I had an hour to talk about just this. It's such a critical component of all areas of adult life. So how do they access their work, their continuing education, their recreation and leisure, their shopping, their healthcare when they're adults, if you don't think about transportation? So I like this slide. I found this from the Easter Seals in Massachusetts, and I will share this as a resource as well. But it's a chart that just helps you start thinking about what are the accessible transportation options for individuals in your community and how is your individual going to access them. I know that in California, under self-determination, they're starting to provide Uber vouchers for individuals with disabilities who can ride transit independently, for example, or your child might be enrolled in paratransit. My son accesses pretty much all of these, except for he does not have a driver's license because of his visual impairment. So again, just really being clear about what is the transportation. Lastly, we want to talk about making social connections. So recreational and social networks are what make our lives complete. We don't want our children staying at home every day. Every individual should have a robust social network in adulthood. They need to develop a sense of self. They need to engage in activities that they enjoy. We want them to have a varied day-to-day life and to be happy and fulfilled individuals. We talked about this at the beginning. Everybody's goals for their young adult might be different, but I think all of us want our young people to be healthy, happy, and to have meaningful social interactions. So really thinking about what is your child or young adult child interested in or drawn to? Where would they prefer to be all day? Do they prefer to be indoors or outdoors? Are they active or sedentary? Do they like watching or doing? Do they like groups, or do they need one-on-one instruction, et cetera? So you want to think about things like what they're going to do with their time, further education. So many community colleges, our community college in San Francisco offers classes for any academic ability. So if they're not able to do the coursework, they would receive a certificate of completion for certain classes. Volunteering might be an option. Partnering with organizations like the ARC, Best Buddies, Special Olympics, et cetera. Finding social clubs, spiritual or religious groups, et cetera. So you really want to be thinking about what is the day-to-day social and recreation, and then also their community inclusion. So they, especially individuals with multiple or severe disabilities, they might require specialized support to achieve community inclusion. Early planning for that support is essential. So as a parent, you can work on that by starting to build intentional communities or circles of friends, introduce them to new settings that meet their preferences or interests, connect them to members of new social groups, and help them to develop social networks to the extent possible. Lastly, I'm just going to share a few tools and resources with you, some of my favorites. So this is Charting the Life Course. I really like these tools. You can go to chartingthelifecourse.org, I believe, and take a look at their tools and resources. So they have you look at different life stages and domains, and then they have different tools like the integrated support star that you can fill out for your own individual. Their guiding principles and their core belief is that all people have the right to live, love, work, play, and pursue their life aspirations just as others do in their community. So we're supporting those positive life trajectories. Here's just an example of those life stages and life domains in a larger slide. And here is my son's mapping family roles tool. I did this when I did a training through this organization. And I think like a letter of intent, my son's letter of intent is about 100 pages long. It can seem really daunting, but this is something really simple that I think anyone can do. So you're thinking about who's caring about your young adult and who's caring for them. So I have we have some very close family friends. And when I started talking to her about how she could be involved in my son's life, she's like, I don't want to be responsible for him, but I love him and I want to be part of his life and I want to care about him. So that really helped me to start breaking this down, and then looking at different areas, what are the people's roles, looking ahead, and then what's important to know and make sure continues and make happen. And then I mentioned the ARC Center for Future Planning also has tools and resources. They have a build your plan tool that you can do online. That is one way to approach this. And another wonderful organization is Protected Tomorrows. They are not a nonprofit. They make money. They do financial services for individuals with financial planning needs. The owner is a sibling to an adult with significant disabilities, and also I believe has a child with significant multiple disabilities, but they have free classes monthly. So you can sign up for a year worth of classes and meet every month and learn about a different topic. And they're incredible resources. So I highly recommend taking a look at this organization. Lastly, I mentioned that we want to be sure that we're thinking about the caregiver and respite. So here are just a few resources on how do you access respite services and supports. So ARCH is the National Respite Locator Services. Caregiver Corner has links and resources. The Family Caregiver Alliance is a great organization, and as well as the National Alliance for Caregiving. So I'm just going to touch on the letter of intent. This is where you think about what you want for your child to live a meaningful and rich life. So after identifying all of these critical elements that we've just discussed, you can start to plan how to get there. If you haven't started doing any of the things we just discussed, you can still start writing your letter of intent. The letter of intent is where you write it all out. This is if I got killed on an airplane tomorrow, what would my husband do? Because my husband doesn't even know all the things that I do, right? If both of us died, what would our family do, right? So that's how you're thinking about this. So how are bills paid for your young adult, or will they be paid? What are their daily, weekly, and monthly routines? Who are the contacts that we want to have on that list? We want all their doctors' phone numbers and emails listed. What about, and friends and lots of other family connections? What do they enjoy the most? What upsets them? Many of our children are exceptionally medically complex and require a lot of care. So we want to explain in the letter of intent or memo of intent your young adult support needs, their services, their current and future medical benefits, as well as your wishes for their future and who will support them either legally or as a natural support. And we want to revise this document annually. This is where you start to think about what is a circle of support. The circle of support should be stated in your letter of intent. And what that is a group of people invited to come together regularly to offer support and advice to the individual being supported. So right now I have an informal circle of support that I've created for my son since I'm still alive, but I've told them you will be his go-to advisor basically when we are gone. And then that's going to change with succession as they age as well. But you want to ensure that your wishes for your child's life when you are gone are honored by a group of trusted advisors. So think about who you can call on for support, who knows your child well, who will care for your child when you are gone, and who else can help. So creating a team and bringing them together can help work towards the common goal of designing a successful, supported life plan for your child. And to really take this seriously, have meetings, take action steps, get others involved. Don't try to do this all by yourself. Here's an example of a letter of intent that I really like from the Massachusetts Department of Developmental Services. This is a nice overview of things that the letter of intent could include. There are lots of examples of a letter of intent or memorandum of intent that you can find online to use as a blueprint. Lastly, public and private benefits programs are often misunderstood. They're often underutilized. There's a lot of inequity in access to income sources and healthcare coverage. Many service providers are totally unaware of or have limited knowledge of the benefit programs available. So you may ask your hospital social worker about this and they might not be a good resource. You might ask your Department of Developmental Services and they might not be a good resource. So it's really important to keep digging. Training is not included in degree programs. So all these people that work in those jobs are not trained on these benefit programs and how they all work. They are forced to learn through trial and error and often at the expense of your child, right? And even when some knowledge exists, many people don't have the understanding that allows them to integrate public and private benefits into a package that best suits their individual needs. Where do we go? So I'm going to just jump really quickly into the chat and then talk about the very last slide. I promise this is the last slide. Where do we go to get help getting these things in place? Are there people who help us through all these things given our child's specific needs? It is overwhelming. And to date, we have no one helping us navigate it all. My daughter is already 18. In the past, asking questions about how we were to do it, we were told not to worry about it at all yet. One problem to date is that with ongoing seizures, the needs are not steady state and are mainly supervisory. So at the beginning of today's presentation, I shared the slide, caregivers as case managers. And I talked about the burden of that and the grief and the exhaustion. And unfortunately, my answer to your question is that you are the one that has to drive this process. There are some states that have care coordinators that do provide more comprehensive services. There is an organization called National Care Advisors. They are really designed for people with more complex medical needs, but that might be an organization that you reach out to. Again, looking at Protected Tomorrows and doing their series of presentations would be another great thing to do, just so that I've done it twice now, 2 years in a row. I listen to them over and over again because there's so much to learn. It's hard to absorb it all at once. So all I'm going to say here is make time for this planning. Don't wait. Don't try to do it all at once. Pick one task at a time. So for the person who just asked that question, your number one concern right now might be the seizures and safety and medical issues. So that might be what I would start with, focusing on that. And then having an accountability buddy. Is there someone else in the community that is at the same stage as you, where you can go through these questions together? Or again, using a group like Protected Tomorrows that has that series of classes that you can take for free and keep going through it. We started a group of hemispherectomy moms a couple of years ago, started going through those classes together, but it kind of fell off because everybody got busy. But maybe you have an accountability buddy or someone who is able to help with that. And then there's a book called, it's also in the chat, I'm Dead, but Now What? But it's not specifically for disabled adults. So that is something good to look at. And then Monica has her hand raised, and I'm going to let her unmute herself and go ahead and speak to us.
Hi, I think the main message is it is overwhelming, and there's nothing we can do about it. We as an organization are doing our best to provide you all with this outline and all this information to process it and to get the steps, in place and start what you need to do. But I always say, like around the IEP process, if you're not overwhelmed, you're not doing this right. I hate to say it. Start small. I mean, what is it? The best way to eat an elephant is one bite at a time.
That's start with that I used at the beginning.
Yeah. Start with your letter of intent. Sit down and every night write one paragraph of the things you want for your child. The second thing I just wanted to interject about is if your child is seizure free, you still need to see a neurologist once a year, because if those seizures return in adulthood many years down the road, and there is a 30-year gap, 20-year gap, 10-year gap of no medical records, it becomes very difficult for that adult provider to really understand what it is that your adult child will need. Ask me how I know this. We have shepherded several adults whose seizures have come back in their early 30s, and it has been extremely challenging to help them with no medical records whatsoever.
Yeah. I mentioned earlier that I will offer a power hour on the medical transition, probably in the fall. Monica, hopefully you'll be there to help me with that. I do a presentation about transition in the IEP process. We just did it. It should be on our YouTube channel soon. And when I do that presentation, I talk about focusing on making sure that a lot of these topics are addressed in the IEP. I just spoke at the National Association of School Nurses, and they just made an appeal to school nurses to start the transition to adult medical care through the IEP process, which I thought was brilliant. I don't know if it will work or if it will take hold, but I think that's a great idea. But here is a quote from Congress. So Congress stated that there is an urgent and substantial need to maximize the potential for individuals with disabilities to live independently in society, but there is no federal requirement for providing supportive services in adulthood. So I'm sorry, I didn't want to leave on a sad note or on a challenging note, but there is no requirement. So all of this, like all the way through that we've done, you know, to get here, I feel like we all have worked so hard to get our kids to where they are because of their medical issues and whatnot. And then it's like, wow, now I have to deal with this. You've got to be kidding me. And that's how I feel. I would say I still spend about 20% of my week focused on my 19-year-old son's transition needs. So medical, federal benefits, school supports, ILS supports, all of that, right? It has not gone away. And I don't envision it going away for me ever. And he is not a severely impaired individual. I would consider him moderately impaired, right? So if you have a severely impaired child, it's even harder because then again, like you get excluded from programs, et cetera. So we are here to support you. We are always thinking about ways to create more resources for you. We do have a transition course online that focuses on the IEP process, but it does touch on some of these issues. So we have a guide and a course. Hopefully someday we can offer a guide on this stage of transition planning in the adulthood realm. And then come to our power hours. Our power hours are opportunities for you to come with like-minded individuals and ask these questions and get feedback and hear how people are doing it in other states. I'm happy to facilitate transition-specific power hours if that's requested. So that's all I have today. If anyone wants to put any questions in the chat, I'm going to stop recording now. So those of you who wanted to ask questions and did not want to be on the recording, everyone else, thank you for joining us, and we'll see you next time.